This year I have been following the measles outbreak that's happening across the country, but I haven't spoken about this a lot. And I came across this story in NPR dated April 15th, 2019. And I know New York has been exceptionally bad, and in other places where the outbreak has really left a lot of children out of school this year. In fact, there are a lot of schools in America that will not even take these children back unless they prove they got their vaccines. So it's been a pretty treacherous year, it seems like, and we're still in the beginning. We're still in the first quarter. Wow. Measles outbreak accelerates, health officials warn. Measles is surging. Last week, the US recorded 90 cases, making this year's outbreak the second largest in more than 2 decades. So, the last time it was an outbreak this large, as you can see on the chart, is 2014. So, this is 2019. We're not out of the woods yet. So far this year, the US has confirmed 555 measles cases. The Center for Disease Control and Prevention announced Monday that's 50% higher than the total number recorded last year, even though we're only about a quarter of the way through 2019. And the virus isn't slowing down. The number of cases is accelerating. Dr. Amanda Khan, a senior advisor for vaccines at the CDC. We are on track to having one of the highest number of cases of measles reported since we eliminated the disease in the year 2000. Well, if we're looking at the disease today, you didn't eliminate it. That's the thing, ladies and gentlemen. Many of these scientists and all these other people will claim diseases are eradicated. Those diseases are here. They never disappeared completely. The majority of the cases are connected to outbreaks in New York, Khan says. This is very significant. This is a very significant outbreak, she says. These cases were imported from other countries. And I know Israel is one of those countries where they're dealing with their own outbreak, and you have Jewish people in America traveling back and forth. And that's how it got spread in New York City. So, but because of low vaccination coverage in these communities, measles is spreading widely throughout these communities. Yeah. So, as you can see, where it was in 2010, 2011, and then it dropped again in 2012. So you can see how each year it went up and down. But it's up again this year. This week, New York City declared a public health emergency, and the ultra Orthodox community in Williamsburg neighborhood of Brooklyn, the city's health department is mandating that parents vaccinate their children, or they may face a $1,000 fine. Wow. So they are really applying the pressure for these parents to get their children's their vaccines. The CDC pointed to 4 other places with ongoing outbreaks in the US: Clark County, Washington; Oakland County, Michigan; 2 counties in New Jersey; and a handful of counties across California. Health officials say there are 2 main reasons for the virus surge: more international travel and lower vaccination rates. Several countries around the world are currently experiencing massive measles outbreaks. Madagascar has recorded more than 100,000 cases since the fall. Wow, that's huge. Wow, 100,000 cases? Woo! Now, I know in Europe they had 41,000 cases, and that was like at the end of last year. Wow. With more than 1,200 deaths, Ukraine has recorded about 37,000 cases this year, and the European Union is tallying about 1,000 cases a month. Globally, the World Health Organization reports that measles cases in the first quarter of 2019 nearly quadrupled compared with what was reported at this time last year. More American families are bringing measles home with them after traveling abroad, Khan said. And once the disease lands statewide, it has a better chance of gaining a foothold because vaccination rates in some places have dropped below 93 to 95%, the threshold requires to protect the entire community. When you make the decision not to vaccinate your children, please understand you're also making that decision for the people around your child. New York City Deputy Mayor of Health and Human Services, Hermina Placio, told NPR on Wednesday, measles can be extremely serious disease. About 25% of infected children are hospitalized. About 10% of the children develop ear infections, which can cause permanent hearing damage. In about 1 in 1,000 cases, the infection becomes life-threatening. In these cases, the virus moves to the brain, causing encephalitis and convulsions. Children can be left deaf, blind, and with intellectual disabilities if they recover. Okay, so this is pretty bad. Before the development of the measles vaccine in the 1960s, the US recorded nearly 500,000 cases each year, the CDC says. About 48,000 kids were hospitalized and about 500 people died per year. We eliminated measles from this country in 2000, and I think we eliminated the memory of that virus. Dr. Paul Offit of Children's Hospital of Philadelphia told NPR Weekend Edition Sunday, people don't remember how sick it could make you. Wow. All right, y'all. We're going to listen to the audio to this article in NPR.
Measles is surging throughout the world. The World Health Organization is reporting that cases have nearly quadrupled in the first few months of this year. And U.S. public health officials say 555 cases have been confirmed nationwide. NPR's Patty Naiman reports.
So far, measles has been confirmed in 20 states. Pediatrician Amanda Cohn, advisor on vaccines with the Centers for Disease Control and Prevention, says cases of the disease are accelerating fast.
We are on track to have one of the highest numbers of cases of measles reported since we eliminated measles in the year 2000.
But more and more parents are opting out of vaccinating their child for religious or personal reasons, and more people are traveling to countries where measles is common.
Countries such as Israel, the Ukraine, the Philippines. When people go to those countries and are exposed to measles and they weren't vaccinated, they then travel back from that country to the United States,
bringing with them the extremely contagious virus.
If there's 100 people in the room who have not been vaccinated, 90 people who are just exposed in a room will develop measles.
Measles spreads when people cough or sneeze. Droplets of the virus can survive in the air for a couple of hours. Dr. William Schaffner, an infectious disease specialist at the Vanderbilt Medical Center in Nashville, calls measles an extremely viral infection that can pose great danger for children who are not vaccinated and come down with the disease. They become miserably ill for a week and a half, he says, and many can suffer severe complications.
You can get middle ear infection, otitis media, pneumonia, which can be life-threatening, and worst of all, 1 in every 1,000 children will develop encephalitis.
where the virus travels to the brain and can inflame brain tissue.
This can lead, obviously, to death, and some children who recover are left with permanent disabilities.
The best protection, says CDC pediatrician Dr. Amanda Cohn, vaccination.
If your child has gotten vaccinated with 2 doses of measles vaccine, your child is highly protected and you do not need to be worried about measles in your community.
Public health authorities in the U.S. and around the world want to make sure that accurate information about the safety and effectiveness of the vaccine is readily available to parents and that parents get their children vaccinated. Patty Neiman, NPR News.
All right, y'all. Well, be careful out here, y'all. You know, there are so many people walking around with infections. It's not even funny. And it's not like you can eyeball them in some cases and tell that they have any type of viruses, you know. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell. And I'll see you on the next video. Peace, family.